because this is the first time I get to tell my life story. Now, my life story starts at age 0. It was a cold winter day at 11 o'clock at night in Poughkeepsie, New York. And it was on the 25th of March, 1941, when I came to be born. And that's the start of my life. And it was not exactly, it was very exciting to the two parents, Lou and Eileen Endsley, from Pittsburgh, both. Eileen was a social worker at the time, and my father was in the military, and but also working at Texaco Oil Company. And they had a little trouble with my feeding, because when my mother didn't have breasts that could produce milk, I'm told, and but she had a bottle, so the bottle was carefully measured, and with nutrients in it, they probably did that. And they warmed it up to a certain temperature that babies would be able to eat and feel good about it. And so they tried to give me some food, and then lay me down to get a rest after the feeding. And all of a sudden I threw up, okay? And so they were upset about that, so they called the doctor, and the doctor said, well, the baby and you need a little time to get used to it. Okay, fine, so they did. And but almost every time the baby, I threw up. And so I started losing weight. So my mother took her into the doctor, the pediatrician, and the pediatrician said, well, you went to college, so you're one of those female deals, you know, wants to be independent, blah, blah, blah. You have to calm down before you feed them, and you have to do this and that. So the doctor picked him up and showed him how to feed him, and so I ate pretty good. And put it back down and threw up again right in the doctor's office. And so the doctor said, well, you need more time to, you know, these girls who go to college, they don't really know what the world is like. Okay, fine, so I'll see you back in a week. So she went home and told my dad, he's throw up again. And so my dad said, I'm gonna come and meet with the doctor and you. So he put on his suit, which he was wearing to work. That's what they did those days. And so they went in, and the doctor said, oh yes, the trouble with feeding. The doctor said, let me just take the baby and I will show you how to feed them, okay? So the doctor did that, and he fed me. And my father, and in those days the doctors wore suits, and Dad wore a suit. And so they fed me, and I looked like I had survived that. And then my father said to the doctor, you better lay him down away from you, because he could vomit all over you. And the doctor said, oh, well, I'm not sure it's going to really happen. So he laid me down. Within 2 or 3 minutes, I threw up. But I missed the doctor because my father told him to lay me down. So they were in the crib, I was throwing up in the crib. So the doctor said, this looks serious. Maybe I made the wrong decision on this, to give you more time to do it. So he sent me down they called it, I never did learn the name of the hospital, Baby's Hospital in New York. Okay, they had a new operation that they could fix. And my stomach, I'll just show you this, I'll lay this down just a minute. The food comes down from your mouth into your esophagus and goes down to your stomach. Your stomach is about this big, and baby is much less. And then it goes into another connection to the duodenum. The duodenum is the outlet of the stomach, and still is. And it has been blocked. It was blocked. So he had to operate on me. Now I was 6 weeks old when he operated. That was the first operation I ever had. And by the way, almost the last. And then he did the operation. I could show you how that works. I'll draw a picture of it later, and then we'll put that in the movie somehow. And then I had to recover from that. And then after that, I started eating. Well, it took a while to recover from the surgery, of course. And I started eating. My mother always said that, well, he didn't eat much the first 6 weeks, But after that, he's eaten everything in the house and gained weight. So she was so excited with that because if we didn't have the operation, I would be dead within 6 months, because you're not eating anything, and there's no way to get food into you. So that was my first experience with medicine, and ever since then, every time I take it off my shirt, I see a scar here. For 85 years, every time I took off my shirt, like as a kid or growing up, and finally I asked my mom, I said, "What's this thing on my stomach?" She says, "Oh, you had an operation." "Oh, I did. What was it?" About age 6 or 7, maybe in that range. So she told me. I said, "Wow, how did that? Who did it?" He said, "A doctor in New York." "A doctor in New York, really?" And so every time I saw that, I said, he saved my life. My mother said, he saved your life. And so I'm convinced partly that I became a doctor because some doctor saved my life. And so I thought, I'll be a doctor. I don't know, at age 6 or 7, but by age 10 or 12, I wanted to be a doctor and nothing else. I had no plan B. And so that was that. About 17 in high school, junior in high school, and I wanted to get a summer job. And I was thinking of going to medical school, but of course I had no experience in the hospital. But I don't know how the hell I got it. I got a job in the hospital as a male orderly in the emergency room. That's different than an intern, different than somebody who's training to be a surgeon. All that is different than that. Okay, but I was a male orderly. What were the male orderly's jobs? The first job they had was to do help the men who were confined to bed, and you use a bedpan to go over, and you and the nurse would help lift them up enough so they could sit on the bedpan in the bed, and it was nicely conformed so it wouldn't hurt us. He could comfortably sit on it, and then he would go to the bathroom, and then I was to take it out, and sometimes if I was taking it out and he moved the wrong way, we'd spill a little bit of stuff out of it. Anyway, I tried not to do that. I worked out ways not to do that.
What's the second thing an orderly does?
Say it again?
You said the first thing an orderly does is that. What's the second
The first thing it's the bedpan. I called myself a bedpan jockey, and everybody laughed at it, but they knew what it was. That was helpful. And then the next thing was, I got to drive. I got down and cover autopsies. If somebody died, I got to prepare the body for autopsy, and that included some stuff that I perhaps wouldn't want to say right now, but it was to block all the leakage of the body. I'll just say it that way. And then also, I would carry the body down to the autopsy room, and I asked to see if I could stand by while they're doing an autopsy, and they said that's the first people I ever asked for that, but okay. And so when I was standing watching the autopsy being done, and I'll just tell you briefly, they cut through the chest and open the chest and check all the heart and the lungs and the spleen and all that, and then they cut down the abdomen and check the liver and the spleen and so forth, and all the intestines. They go through the intestines, see if there's any blockages in there from GI problems. Then they cut open the head, and they look at all the brains to see if there's any strokes or anything in there, or any defects in the brain that during life may have caused he or she to have some difficulty. And then I got to participate. They never let me drive the ambulance, thank God, because I wasn't that good a driver at age 17. So anyway, one of the other guy who's much more experienced orderly in the ER got to drive it, and I was with him. And we'd climb up. In Poughkeepsie, they don't have much elevators in the higher buildings, so we had to climb up the stairs and figure out how to get the guy, often a dead person or a live person, on the stretcher, and then sort of the two of us and sometimes other help would bring him down these curved stairs, and it was you had to be really strong to do that. Luckily, I was strong, and the other guy was strong too. if either one was not strong, you couldn't get them down. So we got those in the ambulance, and then we got to drive the ambulance back to the hospital, and we got to turn on the sirens. And that was for a 17-year-old boy. It was exciting. We got him to the emergency room. We checked him out, started an IV, and started doing it. And then the doctor and orderlies, the real people, came in, and they started to do diagnosis and treatment of this fellow or woman. And so I did that. That was a big experience for me, working on patients who are critically ill in their homes, and bringing them in. And so that was very, very valuable to me, because it determined my dedication to being a doctor. So I was in the process of training to be a cardiologist, and I had finished both of my 2 or 3 years of cardiology, and I passed the entrance exam to have a degree in cardiology because I had been a number of years in training. And then they had 2 tests. At the time they had 2 tests. They only have 1 test now, but they had 2 tests at the time, which is an oral test. You had to go and meet some of the top cardiologists in the country and answer their questions. And then I also had to go to a second one where they were talking about diagnosis and treatment of cardiac patients, including cardiac cath lab. And so, and also taking movie pictures of the heart, which is, of course, the cardiac catheterization procedure, where you put a tube in the leg up into the heart and take movie pictures of both coronary arteries to see if there's any disease or narrowing, as if they might need a balloon treatment or a bypass surgery. And then after that, we expanded the cardiology program with pacemaker, and then eventually, when it was invented finally, angioplasty and stents. Angioplasty means you pass a small wire through the lesion, whether it's blocked or open. It takes a lot more time to get it through if it's blocked, small wire. And then over that you put a balloon. You put the balloon directly in the middle of the tight narrowing, inflate it, and try to compress the atherosclerotic material against the wall, and that will leave an opening in the coronary artery, so that you don't have to help prevent it from blocking. Okay. Sometimes, however, after that procedure, it blocks anyway. So somebody else invented an angioplasty treatment with a stent, and a stent is a coilless steel spring that goes down the artery, and you inflate it slowly and put the pressure of the atherosclerosis against the wall to leave a longer opening. And so we did our first angioplasty in Modesto in 1978. I remember because it was a big event for us. And then we had the opportunity, if a patient had severe coronary disease, we could either treat them with medicines, as some people said they would prefer, or doing a balloon treatment alone versus putting a stent in. We all believed that the stent was lasted longer, and it did, longer than just the balloon only. And so that was helpful. Then we anticoagulated everybody after the procedure to keep it open, because if it finally built up with clots in the artery or in the stent that was keeping the artery open, then it couldn't be not so good. And then we tried to do double arteries at the same time, where we would open one artery, and then if everything was stable, we'd open up the other artery with a balloon and a stent. However, in the older patients, it was hard to predict which artery could be staying open. What I mean by that is, if you open up one artery and it's tight, it's open, looks good, then you start opening the second artery, and the first one blocks. Now you've got 2 arteries blocked at the same time, and that's a very tricky situation. So I tried my best to avoid that, although sometimes we had to do that. But I tried to avoid it, because if one artery blocks, and you open it, and then another artery blocks while you're trying to open the second artery. You have two arteries blocked at the same time. It's like having two heart attacks at the same time. So
How'd you find Richard Smith?
I found Richard Smith. He was working, interesting story, he was working in the South here. I forget the exact place, but it was a good university. And he started out with a pulmonary fellowship. And he did that for 2 or 3 years. And then he did a cardiology fellowship. And then his wife thought maybe he should go to work now. He said, no, I want to do a gastroenterology fellowship. So that was about the time I came calling. The way I came calling was one of his best friends from another college called. I said, I need another cardiologist. I can't work like this forever by myself. And so he said, I know a guy down in South who might be interested. So I said, both talk to him and get him up here and let's talk to him. So he arranged the guy to come up, and he was a character. He had a Louisiana accent, and whenever he was angry, he would always say stuff like this. When we're discussing what we should do and when, and he would say, I think we should do it my way, Richard, but I'll let you think about it and so forth. And he said, whatever you want. And that's what he used to say. That's how they said it in the South, I guess. Whatever you want. So he's angry, he's giving up. Anyway, it was unusual for me. And that was and then when we went to build a new hospital, or a big wing of the hospital for cardiology and heart surgery, heart surgery got to be bigger because they were more important and they were stronger and they were probably making more money than cardiology. And so we went back and forth, so we tried to make it a combined program. Then the question is, how many beds would each have? And so we tried to estimate how many beds would cardiology need and how many beds would heart surgery need. And it was determined that heart surgery would take more beds because he was doing a really big operation and he needed more time to recover than just a heart attack or heart failure or something. And so that's what we did. And then the other interesting thing was this. Richard Smith said he wanted to design the new cardiology group. And I was to run the group and see all the patients while he was designing the hospital. And so, I shouldn't even say his name, but it's true. And he's retired now, so I don't think he minds. So, and he said, at the very end, he said, Steve, look it over. So I sort of looked it over, and other people looked it over. And so when they opened it, the mayor came through to see the new hospital for the county. And so he said, oh, I gotta go to the bathroom. So, okay, fine, go to the bathroom. And guess what? We had forgotten to put in bathrooms in all the rooms. No bathrooms in the hospital. And so we had to have them go down the hall to another bathroom. And so people from that day forward had to get a porta potty out so they could have go to the bathroom in a porta potty, then it was wheeled out and cleaned up. And so that was the one mistake we made.